conversations where you get an opportunity through the auspices of the office of Dr. Danny K. Davis to have this conversation every Monday, and we're grateful to be here. Let's get started by just introducing who are our physicians here for this evening, and I'll get started with you, Doug. Go right ahead.
Thank you, Terry. I'm a retired physician. I worked in the western suburbs of Chicago for about 30 years, and after that, retired and worked in the Congressman's office in Washington, D.C. It was an amazing experience, just an honor and a treat to be here with my colleagues. I'm going to try and answer your questions as best I can.
All right, let's go on around the room. Dr. Maya.
Good evening, community. It's an honor to be here and discuss things and learn with the community. It was a warmer day, so I'm excited about that. The sun is coming out so with people like me that love the sun, it's a good day. And thank you to the congressman and thank you to Nikki for making this space. Ready to learn, ready to discuss, ready to connect.
All right, wonderful. Thank you, Dr. Maya. Mr. Harrington.
Well, thank you, Dr. Mason, my good friend, Dr. Mason, who I did work with. I'm not a doctor, but I do have a background. I have a very broad background. I've worked in a number of fields, behavioral and mental health education, but mostly public health and healthcare. I worked at 3 different hospitals, worked at both the city and the state health departments, and retired in 2017 from the Illinois Department of Public Health, where I was the regional health officer for Cook County and an administrative law judge. I look forward to Monday nights for the opportunity to listen, learn, and where I can to educate. I also want to say I want to thank Congressman Davis for providing this platform. And as Dr. Mason mentioned, he has an earned PhD, so he can be called Congressman Dr. Davis or Dr. Congressman Davis if he chooses to.
Well, thank you very much, Mr. Harrington. And we're going to be winging things a little bit here because the show is in. And I don't see a way for us to see the comments just yet. Maybe Nick will work on that for us in just a moment. But let's go ahead and begin with there's a little thing that's popped up a little bit, and maybe we could ask Dr. Maya to talk a little bit about measles. There was a little bit about measles. Why is there such a discussion around that right now, Dr. Maya? Dr. Maya, I can't hear you.
Well, it's interesting that you said that because I actually also, after I'm done, well, let's lead with it. I think Mr. Harrington can talk about measles because Mr. Harrington always talks about herd immunity. And when there's not a herd immunity, it increases our chances of different outbreaks spreading, like measles. It can be chickenpox, COVID, all those things, right? And so what we know is there's a increased measles outbreak in certain spaces of the country, and they're confirming every day different measles cases. Now, measles is one of those vaccines that we get during our childhood, vaccine schedule. And a lot of times, because I've had different parents that kind of are concerned about the different vaccines, and then they don't get it. And I've seen measles in my practice, which is something that I thought I would never see, right? The measles vaccine, just before we talk about things, are a series of 2 doses. You get the first dose around a year, and then you get the second dose around a year and 3 months, right? And then, a year to a year and 3 months, and you get the second dose around 4, 5, 6, things like that. In your kindergarten, big kid vaccine schedule. And so when that doesn't happen, it makes your body more susceptible to measles. And measles come up as usually you'll see these crops of bumps on the body, and kids are notorious for spreading them because kids touch, hug, hand in the face, hand on the body, things like that. So it's one of those diseases that kind of spread in that manner. They put their mouth everywhere, their airways breathe, and so the most important thing is get the vaccines, keep yourself as clean as possible. And then usually it'll outbreak, you'll see it, it'll happen around kids. But the key to it is back to herd immunity. And Mr. Harrington, if you want to talk more about herd immunity, I'm going to fact check one thing, which is the measles schedule. I believe it's about a year to a year and 3 months, and you get your second dose about 4 or 5 around the kindergarten things. Okay, but let me fact check, because I'm just
you go ahead and do that, Dr. 100.
Okay.
I might rely on Dr. Graham as backup since he is the physician. But herd immunity is when a certain percentage of the population has either had the disease or has vaccination. So we know that those people no longer are likely to get the disease. So we didn't get herd immunity with COVID, and that's the main reason that COVID is still around and we're learning to live with COVID. We had done very well with measles historically because that was a part of routine vaccinations as kids, and vaccinations were, and I believe they still are required by the public schools. They may not be checking as robustly as they have in the past, but there's still a vaccine schedule for children, immunization schedule for children, and measles, mumps, rubella. That's the vaccine they're going to get to be immunized against those 3 things. They will get that. There'll be a series of shots, and that will protect them not only as children but as they move forward. As fewer and fewer children become immunized, and there are adults today that have never been immunized, that means that more people in the population are susceptible to getting measles. And what we're seeing in some areas of the country, that there have been these outbreaks. They're not of concern now, but it's also an indication that we have, because we're talking about having a certain number of people vaccinated, we have a high number of people in those areas that are not vaccinated. Therefore, there's an increase, there's a spike, and there is concern and reason potentially for alarm moving forward. But that hasn't taken place yet. I don't know if you want to add anything, Doug, based upon your experience.
Well, the thing that I'd like to really talk the most about is the fear of vaccines. I know if the audience is familiar with me, I've been a big candidate of vaccines. And I think I need to do a little bit of explanation for that. And that is, one is I grew up with polio. And if you haven't seen it, you don't know how devastating it is to cause a virus that causes nerve damage, so limbs are paralyzed. And this is something that somebody invented a vaccine for, and all of us got vaccinated at that particular period of time. So as part of my training and as part of my continuing education, we were absolutely drilled on the approval process. At every stage of the approval process for new medications, we understood what you had to do to establish that they were safe and effective. So my career spanned 30 years. I probably saw 30 products succeed and get FDA approval. So I have confidence in the process. I also saw a number of products fail. So that when the FDA approves something new like the vaccine, I have confidence in their system. So I think the data is in now after the COVID pandemic. And the numbers of people who were harmed by the vaccines are relatively small. We know it doesn't change your DNA. There's not a microchip involved in here. And we know that the best way to prevent long COVID, which looks like damage to the brain tissue, is by getting vaccinated. So from my perspective, when people say, well, we don't know what's in them, yes, we do. The FDA has been very, very careful and paid a lot of attention to a lot of details to make sure that they're safe before they're released. And we also have 2 to 3 years worth of data in millions of patients to know that these vaccines have done what they're supposed to do to the best of our capacity. So the people who've raised this issue about vaccine safety are playing on people's fears and anxieties, but not really delivering them the facts. And that's the thing I'm most concerned about. If you look at the facts, there's very little reason to be concerned about vaccines, in my experience.
Okay. And then, thank you. I did fact check. It is the first vaccine at between 12 and 15 months, so a year to a year and 3 months. And the second vaccine is 4, 5, or 6. So I was missing that. You know how you get that feeling like you're missing something. 6 years of age. So measles is highly contagious, transmissible through respiratory, in a respiratory manner. And the incubation stage is usually about 10 days, right? Right now in the U.S., the states that they mentioned had some cases of measles. Were a lot of us are talking about Florida, but all the following states have confirmed cases: Arizona, California, Georgia, Indiana, Louisiana, Maryland, Minnesota, Missouri, New Jersey, New York City, Ohio, Pennsylvania, Virginia, and Washington. So those are the states that have confirmed measles cases. There are about, last I checked, 35 measles cases in those 15 states. So if you haven't gotten vaccinated, go ahead and do that. If you haven't gotten your child vaccinated, go ahead and do that. Now, people, you may not be familiar with the measles vaccine because it comes in this group called MMR, right? Measles, mumps, and rubella. They come together, that vaccine. I want to say good evening to Audrey Jaycox. Great to see you again. Connie Taylor, good evening. Marianne Jackson says, good evening, everyone. Tamika Thomas says, good evening, doctor. Well, good evening, Tamika. Nellie Parnell King says, good evening. Miss Deborah Coleman's at Coleman's Barbecue. Hello, how are you? It's very nice to connect with everybody and welcome. I know we're missing Nikki, and the congressman and Dr. Hampton, but we're here to answer any questions you have. So you post them, we'll answer them. Dr. Mason, I want to hand it back to you.
Thank you. And one of the things I'd like to get into is that the so what question with measles. So what? You get measles, so what? Can measles do anything to you on a permanent basis? Are there issues about things that younger people or older people should be aware of? Just a couple questions I'd like to throw out for my internal medicine colleagues.
You mean, so what? You didn't get the vaccine, or
no?
After one time you went out.
Okay, so what I'm saying is, when I said is, I'm saying it tongue in cheek. So what? So what if I get the measles? So is it going to kill me? Is it going to cause some sort of long-term disability with me? Is there a risk for this spreading to other people in my house? And if that is, what's that risk all about? So that's the so what question.
Okay. And so, yes, the answer is yes, it can spread. It's a highly contagious respiratory virus that causes, typically, someone will get fever and a rash, and that's what happens. A fever of 104, and then you get a rash, and that's typically how measles runs its course. But remember, measles and any pathogen, though, measles, we're talking about a virus. The way the viruses work is they have to stay alive long enough to reach the next person. Stay alive in one person long enough to reach the next person, right? And past that, typically, we would think they would go next person, next person, next person. That's the measles that we're thinking about, right? There are those cases where you will get like diarrhea, ear infection, but then you have those cases where, because it's a respiratory virus, meaning it gets in your lungs, people get something called pneumonia. It can spread to the fluid in your brain, and you get this thing called encephalitis. And yes, because you get pneumonia and swelling in your brain, there is the possibility of death, and sometimes, occasionally, people require hospitalization. And the people that are most at risk are the people that were at risk for things like COVID, things like that, because there wasn't kind of general support. But people that are younger than 5, adults older than 20, people that are pregnant, and people whose immune system is compromised for whatever reason are at risk of those severe complications, like, I say full-on pneumonia because Measles is a respiratory virus, so there's an infection in the lung. And I'm like, okay, well, what is that? But a really bad bout of pneumonia, a really bad bout of it infecting your brain and your brain tissues and the fluid around it. And think about it, when you get swelling in that area, sometimes it can cause you to be unconscious, and sometimes it can cause, things like death. But going back to what Dr. Mason said, Mr. Harrington said, it doesn't have to. You can get a vaccine. And what does the vaccine do? It decreases the chances that you will have those severe symptoms that I just mentioned, should your body come in contact with the pneumonia. With the measles virus. Should your body get it, your body's already set up, your immune system is already set up, it knows what to do. It processes it fast, gets it out. Because remember, the first thing I said is the virus wants to stay alive long enough to do damage to your tissues, but keep you alive long enough where it can spread to the next person and then start to do damage in their tissues. What vaccines do is they say, you're not gonna live in my body long enough to do damage to me. And you're not going to live in my body long enough to be transmitted to my loved ones. We're going to end this now on site. And that's what vaccines do. And that's the importance of vaccines. So you said, so what? So you can have a severe complication. And if you don't have a severe complication, but you are in contact with someone younger than 5, people with immune compromisation older than 20, or a pregnant person, it might not hurt you, but it can hurt your family, your loved ones, your community. So it's important to be aware, get the vaccines. We mentioned before, last thing I'm gonna say, and then I'm gonna pass along. We mentioned before, we're in Illinois. So in that list of states, I mentioned Missouri. In that list of states, I mentioned Indiana. In that list of states, I mentioned Minnesota. So it's in our region, it's around us. Let's not wait till it gets in Illinois before we become proactive for our families.
Let's talk
one
about,
of the things.
I'm sorry. Go ahead, Joe. Go ahead, Joe. I'm sorry.
Yeah, what I was going to say, and I started looking at some things online, and one of the things that struck me is measles is an airborne disease. When somebody coughs or sneezes, they're droplets. It's just like the flu. It's just like cold. When somebody coughs or sneezes, and I've seen video of sneeze. If you've seen video of sneeze, you'd be surprised how far those droplets can go. And if you touch something where those droplets are, and then you touch your nose or your mouth, then that means that you have a chance of getting that same disease, regardless if it's the flu or if it's measles. And that's how measles spread, because it is airborne. And so if you're in a house with somebody that has measles and they do have a cold and they're coughing and sneezing, then there are probably droplets in a lot of rooms, a lot of places in the house. And if you touch the area where those droplets are or were, then there's a likelihood that you will get the measles as well, particularly if you haven't been immunized, and you get some immunity from having the measles. But I did see that Marianne Jackson had a question, and I'm going to throw it back either to Dr. Graham, Dr. Mason, or Dr. Maya. I had measles several times as a child. So do I need to get vaccinated now?
Dr. Graham, you want to talk about titers?
That was right on the tip of my tongue. So there's a test that you can do called a titer that will look to see if your body has responded to the measles. So that's the easiest way to find out, because if you show a good level, essentially your body has made what it needs to fight off the measles. If you don't have a good titer, they probably ought to think about vaccines, but also look at the rest of the way that you respond to all other vaccines, because your immune system may not be able to respond to the vaccines, which places you at risk. So I definitely have them look for that, and then look for some of the other vaccines that you had to see if you responded. The second thing I wanted to mention is people are recommending these vaccines not to control you, but to help you. Because those of us who've seen measles that affects the brains know what a terribly devastating event that is, and it can lead to scarring and seizures and impairment. So this is really preventative medicine. It's not something that's likely to harm you. It's likely to keep you from getting a serious problem sometime in the future. So about that question, Talk to your doctor, ask them to get a titer, and you may want to check some other titers at the same time.
What should people do if someone in their family has come down with the measles, or how would they know? Are there some telltale things? Do you go to the doctor and get a test? How do you know that you've got the measles?
If you have those symptoms I mentioned, well, if you experience yourself those symptoms I mentioned, or if you see in your child, right? Because I say it that way because a lot of times people at the age where they get measles, they may be super young and not able to already all the way kind of articulate what's going on, right? So if I'm talking about me, if I get fever, if I get cough, if you have something called conjunctivitis, which is when I don't know if you can see the white parts of your eye, they look super red. We call it injected, super red. If you notice in that, if you're having trouble breathing, if you're having kind of a rash, right? After that, those are all symptoms that you may have measles. And the rash it's not like a little rash right here, a little rash right here. Usually it covers a significant part of your body. It's not like bump, 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 bump. It covers a significant part of your body. And if you have those things, you should look out for that. Now, if the person is unable, like a baby, unable to say, hey, I'm experiencing these things. Well, if the baby starts to not eat, be less active, those type of things. And then you can look at, like, they have spots, right? They're small, they're white, and they appear on the inside of the cheek. You're not usually seeing kind of that stuff. And then it usually has like a border background. You know how a target is like a red spot with a white border, or, a red circle with a white spot in the middle of it. Those are called Koplik spots. You can look them up. I think there's Koplik. Koplik.
She froze.
Well, somebody want to take over? I think she was just trying to describe this Koplik spots.
So I have a question for Joseph. I'm wondering if you know someone who's sick, should you be talking to either the doctor or a public health official so they can follow up with all the people that person's come in contact with?
Well, I would say I'm gonna go back,
Okay.
because Dr. Mason asked the question: how do you know that you have the measles? And the only way you know is to have somebody diagnose you. As a patient, you would know that you had the measles, even if you had symptoms. You would know.
No, you're back.
You froze for a moment, but you're back.
You're back.
Yeah, but that the only way you would know is to have someone clinically determine that you have measles. You would know that you have symptoms, but you wouldn't know unless you saw somebody. But the tricky thing about it is, if you have measles, you really don't want to be in the public, because it's almost like a double-edged sword, because now you expose other people to the measles. I would say if you suspect measles, and you do have a doctor, or someone in the family is a doctor, I would contact them and talk to them, and they could advise you as how best to approach this to get the treatment that you need. They could give you a better idea of whether or not maybe it is measles, or if it's something else, they could talk through it with you. So that would be my immediate advice, because one of the worst places to go sometimes is an emergency room or a hospital, because there are a lot of sick people there. And particularly if you got the measles or an infectious disease with a lot of sick people already there, now you're exposing other people. So I think we do want some caution. I would go back to what we've really been advocating for. We need to get young children. We need to make sure that young children get the complete battery of immunizations that are recommended for young children, to reduce the likelihood not only that they will get measles, but that other people will get measles and some of these other diseases as well. Because if you have a child and you really won't know early on if the child has measles, and they're in school and they have measles, but there's at a point where it has become symptomatic, is what we would call asymptomatic, then they could expose every child in that classroom and the teachers and in the school to measles. So
Yeah.
uh, the vaccines are what really help us mitigate some of these things moving forward, getting the vaccine. And what we're
And
all
something
saying
that
is vaccines are good. They're not, I mean, they're not, you shouldn't think of them as something that's bad or something's going to hurt you.
And something that, really developed as a result of what we experienced during COVID, another option, you call your doctor, you can't go in, but they may give you an option for a telehealth visit. Now, that's not optimal, right? A lot of times we want to see this stuff in person, but call your medical provider, call your doctor's office, see what options they have to support you if you have measles, which kind of, I also want to touch on, like, then what would they do, right? Measles usually will be, for the most part, self-limited. The thing is, you have to get some rest, drink plenty of fluids, because that fever will dehydrate you and it will take all your water out, make it harder for you to heal. Get plenty of water. If the baby is of an appropriate age, herbal teas help. And then you take your fever reducers, like Tylenol and ibuprofen as indicated by your medical provider. And then vitamin A a lot of times helps, but talk to your medical provider about that. Occasionally, that viral infection, because it tears up your tissues, makes you more susceptible to bacterial infection. And if that develops, then your doctor will give you an antibiotic. But typically, there's no known, anti-measles kind of medication. And then, just like Dr. Harrington said, your doctor may recommend that, and we do initially recommend that you stay home, to avoid kind of A, the respiratory spread that we talked about, and then B, touching those respiratory droplets that are on surfaces, and then the child touching their face, touching other people. So, yes.
Well, the other thing that I think that we probably should discuss, and we've discussed around it, but let's say you've got a few children, 2 or 3 children, and one of them looks like may have come down with measles. Do you then self quarantine the rest of those children, or Doug, what do you do?
So I guess my question would be, have they been vaccinated? Because if they haven't been vaccinated, then I think you need to quarantine them. This raises another really important value to the vaccinations. If you remember what Dr. Maya said about when they're vaccinated, they're really preschool, and that is to keep them from missing school when they get sick. Because if you have to go home with measles, you might miss a week of school. Same thing with the mumps, the same thing with rubella. These are all ways of keeping kids healthy to be in school so they can benefit from their education. Otherwise, it's missed school, it's catch up, and you can tell exactly what missed school meant for COVID too. So again, these things are not going to hurt you. They're really designed to help you and to protect you. So I'm less concerned about them.
And I think that's a reasonable approach, because I mean we have to do what we can do. And are there some things that, because I remember as a child, we had all of these diseases. With 10 of us, somebody was always with something, and one of us would always bring something home for everybody else. And there was always a big bottle of calamine lotion or something like that, because these things would be itchy sometimes. But other than that, what should we suggest to families where there may be one child or so that gets measles? What should we be doing for the others? What should we be doing to make sure it doesn't spread as quickly as it could?
And Dr. Mason, if I can add to your question, we have a inbox question, a private message question that says, can adults get the measles? And how does it react in adults? So when you talk about those children, what about those parents?
It is worse in adults than it is in kids. It will hit you harder and lay you lower as an adult than it will as a child. So that's another reason you may have missed work and other things happen to you because of the measles. So it's nothing to mess with. Same thing with mumps. Mumps is much tougher as an adult than it is as a child. There's another question here, and I want to get back to Dr. Mason's, but someone has asked, if your children have been vaccinated, should you get a titer to see if they responded? And I guess the answer I would say is routinely, we probably don't do that. But I would if there was a question as to whether or not they're responding to the vaccines. That is, if they're on medications that would block their response to vaccines, if they have problems with their immune system, asthma, eczema, certain illnesses, that might be the time to check, or on certain medications which would blunt the response to the vaccine. But routinely, these vaccines are so effective, I don't think that most people order titers after children are vaccinated. But to respond to Dr. Mason's questions, from my perspective, if you've got one child who's sick and an unvaccinated child at home, I think you have to quarantine both of them.
And for how long?
Okay, the unvaccinated child will develop measles and will then become a carrier and spreader if that child returns to school. So I probably would keep that child at home until their measles has run its course.
And that could be how long, Doug?
Pardon?
How long could that be?
I'd have to defer to Dr. Meyer, Dr. Joseph Harrington for that.
I can't. I'm not a doctor. I can't say, but I could go and I could find it out. But because the course probably varies, and I don't know if there's a rule of thumb about how long a person has measles. But so that would be the challenging thing, because it may be an individual thing in terms of the actual course. I see Dr. Meyer shaking her head. But I would say the one thing that you want to make sure is the person is symptom free. If they're symptom free, it should be safe. If they're no longer experiencing symptoms, but if they are still experiencing symptoms, there would be reason to err on the side of caution.
Dr. Meyer, is there some risks to our senior population, or are we assuming that many of them have been vaccinated or may have been vaccinated? What should we be telling our seniors?
Kind of exactly what Dr. Graham said. Once it hits hard, and a lot of times our seniors or, adults in general don't heal as fast and don't have the same comeback. Just exactly what Dr. Graham said. The other thing is, how long should you keep them out? I was saying, yes, you're right, Mr. Harrison, because I'm used to seeing you on Harrison Street, but Mr. Harrington. I don't know how long I've been saying Mr. Harrison, but I apologize. Measles is the rule of fours, right? So it's contagious 4 days before the rash and 4 days after the rash. And the rash looks like, again, this is generalized like blotchy situation with a separate rash, usually on the inside of the cheeks, that are reddened, but they got white spots in the middle of them.
I have another question for you, Dr. Mike, that is, if you someone at home that has measles, how does that work with showering and or bathing? Are there things you need to do between the times that people use those things? I'm not trying to get everybody paranoid or anything, just asking some basic questions.
Yeah, well, if I'm at home and, I'm sharing space with someone, I have the measles, a couple of things, taking it back to the mask. Anytime you hear something is a contagious respiratory illness, you got to take it back to the mask, right? You are going to decrease that contact with that person. I've recommended in the past, like paper plates, things like that, paper plates, plastic cups that they kind of throw away in their own trash, things like that. Possibility of keeping that person in a separate room if they can, they eat in that room, and if they have separate restroom spaces, I do say use it then, but what if you don't have a separate restroom space? A lot of times the most, our families kind of, or what if you're a baby, and it's your parent, a lot of times you try to stay as safe as you can. Yes, if you have to use the same shower, you can use different sprays, clean it really well. But the most important thing that I tell people to do is you're going to isolate, yes, and you're going to check in your vaccine record. I think now in Illinois it's available. I believe so, but you're going to check your vaccine record, see if you got your measles, right? Your measles MMR vaccine.
Yeah, two things, and these are related to the overall conversation. Is one, it's important for people to know that as we get older, our immune systems become compromised, and so you really don't. If you've never been vaccinated and you're older, you really don't want to be around somebody with the measles because you have a compromised immune system, and as they've been pointing out, it'll be much worse as an adult than it would be as a child. The other thing, and this is just from experience with chicken pox, the last thing and one of the most difficult thing for a child to do, and I know when I had chicken pox, is my mother said, "Don't touch that spot, don't scratch it." You could wind up having a scar or a blemish somewhere that you'll be embarrassed by the rest of your life. But one of the most difficult thing is when you itch all over and you got bumps all over you, the immediate urge is to scratch or to pick at it. And that's the worst thing you could do moving forward.
So, Dr. Mason, there's an inbox question for you. So, I don't know how you want to answer it or if you want to have someone answer, but let me open up the messages again. The question says, Dr. Mason and Dr. Graham, thank you guys so much. You said the older you get, it hits harder and it puts you down. Well, my husband has something. We went to the doctor. And I don't know if this is the measles, but they said it's a childhood disease that hits adults, and they said he has shingles. However, one side of his whole body is swollen up. He's in severe pain, and he looks like he has the chickenpox or the measles all on one side. We have him in a separate room, and thank you, Dr. Maya. We are feeding him with plasticware and on plates, on paper plates. The doctor said that this will go away, but he looks horrible right now. Nikki, I sent this inbox message because everyone would know who my husband is if I wrote it in the general comments. So she says she actually goes on to say he looks almost like a monster and he's in a lot of pain. And she says it's one side of his face and chest, and she's really afraid for her husband.
Dr. Meyer, you want to take that?
Hey, I just had some technical difficulties. I just got onto something on the chest and really afraid for her husband. I'm so sorry, Nikki. If you say it again, I'll be happy to take it. Nikki?
I'm sorry, I'm trying to pull it back up, but I don't want us to have dead air time. So I kind of have it in a summary. She was basically thanking Dr. Mason and Dr. Graham for their comments. She said her husband has something that it did hit him hard and laid him down quickly. She was wondering, was this the measles? They went to the doctor and they said that I took him to the doctor and it says that he has something called shingles. However, my husband looks really bad. One side of his face and chest is really swollen up and it looks like he has some form of the chicken pox. She's saying that her husband looks like a monster almost. She said all the kids are afraid, but she is doing what you said. They are feeding him on paper plates, plastic utensils, and paper cups, and they have separated him in a room by himself. She says he's in a lot of pain, but the doctor says that this will go away. However, she is very afraid for her husband. I guess the visual of it must be bad.
Mm-hmm. Yep. And so what happens is, the amazing thing is, she's spot on. She said, it looks like chicken pox. Okay. So what happens is people get chicken pox, and then your body has an immune system. Your body says, okay, you're not going to go too far, chicken pox, get it together, and your body doesn't kill the chicken pox. It just calms it down, right? And then what happens is the chicken pox virus just goes to sleep, and it usually goes to sleep in they call them dorsal root, but the nerves, right? It'll go to sleep in the root of your nerve and somewhere along the nerves. Then you mature, you have stressors, things like that. It wakes back up, right? But because it went in your nerves, and there's something called dermatomes. We've seen them pictures where a person is divided into things that look like this, these different lines. Those are our skin lines, how our skin grew. How our nerves grew, sorry. And because it goes like that, they're called dermatomes of skin, how the nerves go across the body. It'll literally because it was sleeping in the root, it'll literally pop up and crop up in a line or in the lines that it went to sleep in. And so that's why it'll be on one side of the body, not on the other, on both sides, just kind of like somebody drew a kind of line like that, but then they pop up around there. It is painful for a lot of people, you know. So, and then because of that, the body's trying to heal it. Dr. Graham can tell you about how the inflammation goes to that spot, and that's why he's so swollen in those spots, right? It usually does go away. The recommendation is that people do get the shingles vaccine, I believe, at age 50 now, unless they're immunocompromised, but then they should get it earlier. But yes, and then look again and see if, once it moves, I believe, and I can double check for you. The recommendation for the shingles vaccine is like, okay, you got shingles. Maybe you didn't get the vaccine at age 50, but now that you have shingles, ask your doctor what should be your route for considering the vaccine, not immediately, but in the coming months, ahead, and when you should get it, because just because you got shingles doesn't mean you never get the vaccine.
So she sends back a thank you, and she sends back a thank you, and she says, she's just reiterating once again, she didn't want to put in the general comments because people would know who her husband is, and she didn't want to out him. But she did re-ask the question, should the rest of the family quarantine from him? She feels bad for treating him this way, but they have quarantined themselves from him.
I see Dr. Graham, you want to take it or?
Go ahead.
So, I think that depends a lot on their immune system and their immune status and whether or not they've had the vaccine for chickenpox. If they're not on medications that suppress their immune system, they're not likely to have, it's not likely to be contagious to them. But that doesn't necessarily mean that if it were me, I wouldn't follow, the things that you only do, like wash your hands, washing the sheets, using wipes to wipe things down. Because I don't think I'd want to take the chance of passing on to someone else that I didn't know who might be compromised and passing it on to them. So I don't think that if other family members are healthy and they've been vaccinated, I don't think they're at risk.
I would just want to just make a distinguish between the measles and the chickenpox. Those are two totally different viruses that cause those two things, and they have two different courses of the way they heal and the things that they can and cannot do. Yeah. So again, I'm going to defer to my medical internal medicine colleagues, Dr. Meyer, Dr. Doug, to talk about those two things just in what they are, so that people can be clear that they're not the same, they're different.
So the interesting thing about measles is it's usually one and done. Once you get it, you usually don't get it again. With chickenpox, your body never really gets rid of the virus. It stays, as Dr. Meyer said, asleep in your body. But as Joseph Harrington said, as you get older, your body's ability to keep it asleep tends to get weaker and weaker over time. And with certain illnesses, certain medications, and certain stresses, the defenses break. So you can get that infection a second time, and I've seen it a third time. So,
and the pain, Dr. Doug, is that related to the chickenpox more than the measles?
It's trying to get rid of the chickenpox. It essentially tells us what's left of your immune system. We have a foreigner here, get rid of it. And so your body starts to try and attack it, and it releases chemicals that cause the pain and the swelling. And unfortunately, where this battleground takes place is at the end of the nerves, which is where all those pain signals start. So, measles doesn't quite affect the nerves, except if it gets around the tissues of the brain the way the chickenpox does. So that's another kind of interesting difference between the two of them. And so those poor little nerve endings, think about that. When you touch your finger on the stove, you get a little burn. Well, think of all those little nerve endings being exposed to this rather intense chemical bath as you see all these blisters and swelling going on. So they're getting beaten to death, during this episode. Now, if you're lucky, this all calms down and things kind of can go back to normal. But there's some people who are left with inflamed nerves for a long time, and it can be very, very challenging to manage. So it's another argument Why get that vaccine? Because you don't want to have to deal with this if you're unvaccinated. It can be very, very painful and uncomfortable.
Anybody else want to add anything, Dr. Maya, or Dr. Harrington? Because this
Well,
is a
I did put the, and I don't know if it went through, I put the recommendation from the CDC for the shingles vaccine in the chat. And I see it sort of got garbled, but there should be, because I actually copied it from the CDC's website. But it does speak to this issue. It recommends that adults 50 years and older get 2 doses of the shingle vaccine called Shinglex to prevent shingles and complications from the disease. That's the basic recommendation.
And Joe, it's there, and people are actually liking it. So they are tapping on it and they are looking at the information. So it is definitely there. Want to say hey to Valdemir Talley, who is here. He says, good evening to all. Virginia Knight is here. And she says, evening to everyone. Everyone. I think you guys grabbed Marianne Jackson's questions. Want to say hi to Yolanda Williams that is here also. And Barbara Ivory, Dr. Mason, is here. And she says that she is watching. Now, did you get Tamika's? I think Maya did. I think Dr. Maya did mention your niece, Tamika Thomas, who was here just as well.
hey, Mika. Yep. Yeah. I thank my niece for always watching. She's right there, but she's going down a medical path. So this is all consistent with what she wants to do.
So, Dr. Mason.
Yes, ma'am.
How about those measles? Measles have me scared now. Oh my goodness, measles have me scared. And the chickenpox have me even more afraid now. I think I'm going to go take a titer test myself. I've had both. Oh, but I have a question. What's the difference between measles and rubella? Because I had both of those.
Dr. Graham?
They're different viruses.
Yeah, they're totally different.
Okay.
Yeah.
And the thing is that we've got to understand that, hearing about chickenpox, Maya, brings back the days that I'm one of 10 kids, and we all had chickenpox at once. So you can imagine what that was like. We had gallons of calamine lotion bought by the visiting nurses from the city Department of Public Health, and basically, one good thing about it is pretty self-limiting. If the body's otherwise healthy, it will usually clear itself. There may be some scarring if you scratch or pick at these scabs that are there, and but the pustules are places where the viruses do come from. We just have to be careful about not spreading things that way, both that and the measles as well. Although the measles not as bad. Does anybody else have anything that they want to think about in terms of protection for people that are not having this, but maybe in the same proximity? I know, Dr. Mary, you've talked about a number of things. We want to review some of that for the people who have not yet come down with it, but may be in a home with someone. The things that we might want them to make sure they do.
Well, there's a very basic things. Wash your hands often. Soap and water is probably best, but wash your hands, because you never know when you may have touched a surface that has something on it that will cause you to get an infection. I mean, one of the things that's really interesting, and it really was around COVID, is because people were wearing masks and more people were washing their hands, we had a lower and more people were vaccinated against the flu and COVID. I mean, we had fewer episodes of people having flu. I mean, so it's some of the basic things that everybody can do are just, when appropriate, wear a mask. If you're in a house with people that have some kind of respiratory illness, particularly one that's going to spread, wear a mask. If you're around people where there's a likelihood that you'll be exposed to some kind of respiratory virus, wear a mask. And the other thing, and I know that really is struck home for me, is every time I go out of the house now, when I come in, it's become a habit. If I leave the house and I come back in the house, I wash my hands. Every time I go out, I come back, I wash my hands. I go someplace different. Sometimes I wash my hands. And you would be surprised at how much that reduces the likelihood that something will happen.
And Joe, I love that comment, and I loved when we used to talk about COVID, and Dr. Maya would teach people how to actually wash their hands and how to wash them properly, because you miss some things. I mean, you just used to just rubbing them together, but there's an art to washing your hands. And one thing I tend to do, since I am and I think all of us here on the panel are Christians, but I go to church, I say one hand for handshaking. I try not to handshake. I try to, fist bump. But when you do handshake, because I don't want to hurt other people's feelings, I save that hand. I do not touch my face. I don't do anything with it. I go to the bathroom and I wash those hands. And then I also put a little hand sanitizer on it. And I do not want people to forget those shopping carts at the grocery stores. If you are at the grocery stores and you are using those shopping carts, remember to put hand sanitizer on before you touch your steering wheel and begin to drive, before you start doing stuff in your car and going through your purse and finding a piece of peppermint to have on your way. Put some hand sanitizer in those hands and wash those hands. Those carts handles are filthy.
I just wanted to ask Dr. Maya a question too. Dr. Maya, is there anything that we should be saying to the audience about handling clothing or bed linen or anything like that of people who may have this, because some of the virus, for lack of a better term, the virus juice might be on some of the linen?
So what I usually mention to my parents is after change it frequently, change it frequently. And then the way you change it is you wear gloves, you take the underside, how the bed sheet, I call it the curly and the flat. I know that's not the name of the sheets, right? You take the underside and you kind of wrap all the sheets on top in a little ball using I usually tell them to get the contractor bags, not the grocery bags, but because the contractor bags are bigger, and you close it, and then you only that kind of stuff, that the clothing, the stuff, the bed linens of the person that's impacted, that got measles, and you dump it in the washer and you wash it. That's what I've been telling people. I don't know what other people have been telling them. So you grab the under.
So
this
Florinda
is
Florinda, who's a nurse at the VA, she wants me to share with you. It's the fitted sheet. She said you roll everything up in the
not the curly sheet. Okay, so you get the underside of the fitted sheet and bring it over everything like a little ball. Put that so that you're not touching the surface, and then you put that ball in the bag. Close the bag up, because you don't want the bag like carrying through the house and stuff like that. You close the bag up, you take it, you turn it on, turn it upside down on top of the washer, or if you have a front loader in the washer, and then you let the stuff out there, close it, wash it.
And she also shares that that's the purpose of the fitted sheet. It's not just to fit on the bed. It's actually to fit, to make sure that if you need to have soiled sheets, that you're not spreading that. She said, so that's what that sheet is actually kind of used for. And she said, thank you. You validated them by calling it the curly sheet. It's the fitted sheet. Roll everything up.
They out there like the doctors don't know what they're calling it curly sheets. But I'm thankful for our nurses,
No, but you're using it for the right purpose. You was using it for the right purpose. So she said you were validating her.
And thank you for helping me. What's her name?
Florinda.
Thank you, Miss Florinda. Fitted sheets.
And she's also a veteran. So she said that, those sheets there, when a vet makes the bed, you can bounce money up off of it. So,
yep.
Well, I know you guys hate when we say this, but it's our time. So I know you guys hate that so much. So Dr. Mason, you have been a wonderful host tonight. Why don't you go around and get everybody's comment until next Monday?
All right. Why don't we start with Mr. Harrington?
Well, mine is very simple, and I thought about this as we were talking, and this is something that everybody's heard. An ounce of prevention is worth a pound of cure. And we've been talking about vaccines. We've been focusing specifically on the vaccine for measles, but there are a lot of vaccines out there. And make sure, regardless of your age, and if you have children that need them, make sure that everybody gets the appropriate vaccine for their age level. And that way we can all be healthier, and it's less likely that others of us will get these kinds of diseases.
Dr. Maya.
Just thankful for this time today. And again, there is a theme that I'm hearing. I'm thankful for this space that we can say, hey, this is coming or it's around our community. What are the things we can do? I'm thankful for that because I know, when I was young, when I was growing up, we didn't have a space where a community can come and hear like, hey, this is what's going on in our community. And here's what we can do to protect ourselves. So, I know I'm listening, and the things I'm learning right here, I'm definitely employing, so.
All right, Doug.
Well, I just want to add to what Joseph Harrington said, that these vaccines are designed to prevent illness and to prevent suffering. The thing I really want to share is the technology to develop the new COVID vaccines was 20 years in the making. And the people who started on this path tried to develop a vaccine for HIV. In 2023, they were given a Nobel Prize for this technology. It wasn't given to them for making a pile of money. It was given to them because the impact on the health of the population. So understand, these vaccines are recognized and valued as a way to prevent suffering, to keep you healthy, and they're a vital part of your health today and in the future.
Thank you so much. And I'll end by saying that being one of 10 kids, when we had this all at the same time, all of us had chickenpox at the same time. And so it's really, I want to just take my hat off, first of all, to the moms and other caregivers, because this is a tremendous amount of work. And we want to thank all of our caregivers. And if we have nurses going out to homes, thank them for coming out to do this kind of work. It all still boils down to the same thing. We have to make sure we clean the bed linen. We still have to do all the other things that we have to do. And we have to take the appropriate precautions, as we mentioned earlier, about handling these things from people who have had the opportunity to get one of these viruses and have the juices, the fluid from that virus in on these particular pieces of clothing or linen. I think that's it. And I want to thank again, the Congressman and Nikki. Thank you so much for having us on today. And it's always good. And we hope that it has been in some way a blessing to everyone, that they've got something out of it for them, because that's what it's about. It's not for us, it's for you. So we thank you for being patient with us as we try and help each other.
Outstanding. And thank you guys so much. Just want to remind you that the FDA has approved the first generation of the sickle cell cure. So make sure that if you are suffering or have a family member that may be suffering, make sure that you appeal to your doctor to see if you are a candidate for this. And I just want to remind everyone once again, on Sundays, don't forget, is there a doctor in the house? It absolutely is. It's Terry Mason on radio. Make sure that you listen to Dr. Mason when he talks about, is there a doctor in the house? Is there a doctor in the house? Good night, everybody.
Good night.